This is on psychotic illnesses for Patho. Psychotic disorders are an altered thought process that interferes with perception of reality. Practitioners use the Diagnostic and Statistical Manual of Mental Disorders, also known as the DSM, Diagnostic and Statistical Manual of Mental Disorders. There are more than 300 different psychiatric disorders listed in the DSM. SMI, or serious mental illness, is a mental, behavioral, or emotional disorder that is diagnosable currently or within the past year and results in serious functional impairment that interferes with one or more major life activity. Psychosis is a serious and debilitating mental state or condition, a mental disorder characterized by a disconnect from reality, hearing or seeing things that do not exist, or believing things that other people do not. Hallmark symptoms of psychosis are delusions, hallucinations, cognitive disorganization, altered reality. Psychosis is a condition that affects the way the brain processes information. It causes a person to lose touch with reality. A person can see, hear, or believe things that are not real. Psychosis is a symptom, not an illness. It can be activated by a mental illness, a brain injury or illness, substance abuse, or extreme stress. Psychosis may occur as a result of physical injury, schizophrenia, Alzheimer's, Parkinson's disease, a high fever, head injury, heavy metal toxicity, and a side effect of medications and drug use. Early warning signs before psychosis: a worrisome drop in grades or job performance, trouble thinking clearly, or concentrating, suspiciousness or unease with others, a decline in self-care or personal hygiene, spending a lot more time alone than usual, strong inappropriate emotions, or having no feelings at all. Possible symptoms include delusions, hallucinations, talking incoherently, and agitation. The person with the condition usually is not aware of his or her behavior. People may experience behavioral disorganized behavior, aggression, agitation and hostility, hyperactivity, hypervigilance, nonsense word repetition, repetitive movements, restlessness, self-harm, social isolation, lack of restraint, and persistent repetition of words or actions. Cognitive, the thought disorder, confusion, belief that an ordinary event has special and personal meaning, belief that thoughts aren't one's own, disorientation, racing thoughts, slowness in activity, thoughts of suicide, unwanted thoughts, difficulty thinking and understanding, or false beliefs of superiority. Okay, with mood, there would be anger, anxiety, apathy, excitement, feeling detached from self, general discontent, and limited range of emotions, loneliness, or nervousness. Psychological, there would be fear, hearing voices, depression, manic episodes, paranoia, persecutory delusions, religious delusions, and visual hallucinations. In speech, there would be deficiency of speech, excessive wordiness, incoherent speech, and rapid and frenzied speaking. The psychotic episodes can occur in 3 phases. The first one is prodromal phase. This is the period where the person is experiencing changes in feelings, thought, perceptions, and behavior. Hallucinations and delusions have not started yet. In the acute phase, this is where the symptoms of psychosis begin to surface. This is the critical period. Clear psychotic symptoms are experienced, such as hallucinations, delusions, and confused thinking. And then in the recovery phase, the acute symptoms reduce in intensity or go away altogether. And this would depend on their pre-existing conditions, if any. It may be a one-time episode due to stress, or a relapse may occur if they have an underlying mental condition. Some people do not experience a second episode, whereas others do. Can psychosis go away on its own? Brief psychotic disorder, it can go away on its own, as this is usually a one-time event. If it's substance-induced psychosis, it may go away on its own, especially after the medication has cleared the system. If the psychosis is a result of an underlying mental health disorder, it is unlikely the psychosis will go away naturally. During a period of psychosis, a person's thought and perceptions are disturbed, and the individual may have difficulty understanding what is real and what is not. Stress and psychosis. During an episode of psychosis, the brain is in a state of stress overload. When supporting someone experience psychosis, you should talk clearly and use short sentences in a calm and non-threatening voice. Be empathetic with how the person feels about their belief and experience, and validate the person's own experience of frustration or distress, as well as the positives of their experience. Now keep in mind, when you're validating somebody, that's not the same as you're agreeing or disagreeing with them. You're just validating them. Okay, so some people misinterpret, well, if I validate this person, then that also means I'm agreeing with them. No, they're two different things. Validation is just a way of disarming a person, calming them down, connecting with them. It's a very valuable tool.